nyina ye hu momfanya hincha ne fata no nye de wodi hu be hye mu esi ho abakwan ene ma bo bia be wura mu bi ya bre tiye masabe preko bi fi bola so meye ye hu fi yodi mi dia ko hye baby a wokwenche me fire no onfa ne ntwe koma boso yodi echi ne mezaya no
nyina na maye no level na medu no banko me chama ko ojana so atanfo mede da me fom mezaya mabo umra mede da me fom mezaya mabo anybody to be share yeah
abofra hu ne nsa kokora woni mpanyifo didi ansana ni freni beto bo na ne nsa kuta bibi mia na maye nkoda nketo asu kono ma mahwemo ama musie fifi penda me kana ya kebe ya baso ya so asisi nyanso nya bema ne bema na bema ne ni osi bedwemu ese bema ni de na maye mu amuta me ni saka mu kwanka mewu ama ye meye pomo chichie friso mo be kasa de nche mewu a si de na sebe wo twanya woti fie ni ne bedie chini.
Good evening to everyone. Hello and welcome. My name is Dr. Kofi Ansabrefo, and you are listening to the Derma Dialogue, where we talk about the skin, anything related to the skin. This is Z101.9 FM, and I am your host. You can also stream us live on radio.zmultimedia.com. You can follow us on Instagram, Facebook, and X at ZFMGH. Also on TikTok, on YouTube at Z Multimedia. This comes your way every Saturday, 6:30 p.m. This is the only program dedicated to your skin, generally, so skin health. We talk about all skin care. We talk about your skin type. We talk about your baby skin care. And today we are discussing something very interesting, very sensitive topic. We are discussing skin bleaching. This is one of the things that these days is very difficult to talk about them or to talk about it. It's been with us for a very long time, but now it's getting out of the hand. Now, skin bleaching is no longer just a cosmetic trend. It is a public health, dermatological, psychological, and even socio-cultural crisis. Across Africa, there have been reported use of bleaching products, which varies widely. Now, with WHO Africa noting regular use amongst, women. So they report about 25 to 80% of women in some African countries. And sometimes, in our center, or in some Ghanaian studies, we also report a substantial use in regions such as Greater Accra region, Kumasi, and Brong-Ahafo. So definitely, skin bleaching is something that needs to talk about. We need to discuss it. Now, back in the days, we used to do. We used to tighten, or we used to ask FDA to tighten. Some of these bleaching products, but unfortunately, yes, they are doing a very good job. They are regulating when it comes to products on the market, but some products or certain products still find their way on our market. Now, today we are going to delve more into skin bleaching. We want to know whether skin brightening, skin whitening, skin toning is the same as skin bleaching. We've received several questions from you, especially when bleaching now has to do with kids. So now people are actively applying certain strong or harsh products on their kids, and that's getting worrisome. There are so many times when we use certain products. For instance, a child has ectopic eczema, where we typically use a steroid. But now we are using for a different reason or a different purpose. We are actively using the steroid to bleach the child's skin. There is a history to skin bleaching. It's been with us for a long time. In the past, Being affluent, yes, the definition of being affluent, was defined, or affluence was defined in a certain way. In the past, where people used to travel, where if you have reached, or if you are an affluent, you are supposed to look in a certain way. So then you have people who are putting on weight. That's the first one. And secondly, they look fair, or they have a very lightness when it comes to their skin complexion. And this has been the norm. People used to use very strong creams, what we call Abidjan creams, in the past. And it's the same creams that now, it's metamorphosized into something else. But it's still skin bleaching. Now, this evening, we are going to talk about skin bleaching. It's a very sensitive area. And I must admit, it has to be, it has to be approached with some compassion. Because I tell you this, most people are not aware of the products they are using. I've had instances where some people, because they had some itchy rash, they were put on what we call steroids. Steroids are not to be used for a longer period of time. So that's when it comes to us, or when it comes to the doctor who prescribe it. We don't do more education on the side effects on some of these steroids. So we are here today to tell you all the complications, all the questions. We've received so many questions on skin bleaching. We are here to discuss skin bleaching. I will do a quick commercial break. Once we return, we are going to do more on skin bleaching. What is skin bleaching? Is skin bleaching the same as skin toning? Is skin brightening the same as skin lightening? Is skin whitening the same as toning? Just stick and stay, and we will be right back.
What's up? Coming out of the ghetto where the gunshot always a echo. You don't know? Hear the road boy cry.
Hey, Ujanku Bonnet. All I can see. Sometimes I try to make them true. All I can see. Sometimes I try to make them true.
I never thought it could be until I saw a man try. Hold the source of his feet on the heat to his peak. It shall be well, it shall be well. Oh Lord, my cup is full and my soul is many are called but chosen are few. My cup is full and I help with you. It's good to the tops and prop like you. And you walk one living good till you're good till you're dead. The fire keep burning, pray the end word. Cry no more, cry no more. My brother cry no more. Yeah, don't cry.
All I can see. Sometimes I try to make them true.
I keep dreaming my big dreams.
Big dreams. All I can see.
All I can see.
Sometimes I try to make them true.
I've been walking all day, trying to find some bread and butter. Bread and butter. Oh Lord, a time will tell the poor man still be want a nice and a better place to live, but they want to make it good. Oh yeah, I can't kill every night and day. They all have to go. Oh my sister, cry no more. Oh. Ujankupon, minyami. Oh, Ujankupon.
All I can see. Sometimes I try to make them true. Big dreams. All I can see.
know Jaja won't let me down. Hey. All I can see, hey, hey, hey.
So you are welcome back. It still remains the Derma Dialogue on 101.9 FM. And I am your host, Dr. Kofi Ansabrifo. We are discussing skin bleaching epidemic, and skin barrier repair. And I must admit, this is a very sensitive topic. But we are going to approach this with compassion. We are not here to judge. We are here to tell you about what we need to do, or what could be done in case we are victims, or in case we've used a product that was a bit harsh. In the course of it, we notice we are getting stretch marks, we are getting sunburns, we are getting redness of our faces, we are getting, we are getting darker. Or now the very important thing is, what we do is, most people, the problem is, once they come off the strong products, they are always forced to go back to them because of the stigma, because people seeing them and telling them that, or asking them how come they are looking dark. Or, the very common thing you hear is Nancy Okalanedum or Nancy Washi. So basically, that is why we are here. We are discussing skin bleaching, but with a different approach. Now, we have so many questions. There have been so many questions that we've received. And what I will do is, today's session, it has to be more interactive. I'm going to go by all the questions. Then we see how best we can, and especially in terms of the repair, skin barrier repair. We'll also touch on that one. And that's what we are going to do today. So, what is skin bleaching? Basically, we altering the natural, or our natural complexion, and it can be done in so many ways. We can actively use a topical, something that we are applying on our skin. We can also use some oral medications as well. So these days, in terms of what to use, it cuts across. You can use a topical creams. You can also do orals. Can do some IVs as well. So some injections. So there are so many things that could be done. Now, the first question we want to look at is, in terms of how widespread is skin bleaching in Ghana, or across West Africa, and what groups are more infected or more affected when it comes to skin bleaching. So yes, as I said earlier on, skin bleaching is no more a cosmetic trend. It is more like a public health or even dermatological or psychological crisis, because it cuts it everywhere you go. These days, it even happens in our kids as well. So definitely, it cuts across. Now, in Ghana and West Africa, skin bleaching affects mainly young women. Students definitely also have their share. Then traders, especially our mothers, Mokola mothers. So definitely traders are also more affected. People who find themselves in the entertainment industry, celebrities and stuff, So sometimes the definition of beauty it sways a little bit from just having a healthy skin to now actively, changing our complexion or our skin complexion. So then a very important thing that we need to also take note is social media pressure. So these days, social media is very powerful, and people are selling all sort of things. And there are times when you are just going in for very mild, as they say, a normal cream. But the question that they ask you is, are you a fair, or are you a dark person? And most of the time, nobody wants to admit that they are dark. So then we keep on using terms like, if you are fair or if you are dark, then we need something that will add some tone. And these are the reasons why people use certain creams. And these days I get this a lot. People asking me, Doc, I mistakenly started using this product and I didn't know. They said it was organic, only for me to realize that now my my complexion is changing. And in addition, I'm getting these sunburns. So definitely, skin bleaching. When it comes to skin bleaching, is widely spread. It affects almost everyone, but mostly young women are more affected. Now, what social or cultural or even economic factors keep driving the demand for skin lightening products despite the known risk? That is a very interesting one. So, the demand is driven by colorism, and this is something that we need to work on. So, in certain areas, you notice that fairness is being associated with some privileges. For instance, even beauty. Our definition of beauty is now a bit different. So, how it's been driven by perceived beauty advantage. When you are fair, we tend to get some attractions, and because of that, people who really want to actively be fair. So definitely that one. Now, celebrity culture. These days, you have so many things on the market, and once you have some celebrity, pushing for it, or some celebrity looking a different way, most people look up to them. So we tend to start using products these celebrities are using. And a very important part that we need to is very sensitive, but definitely low self-esteem. Definitely we need to talk about low self-esteem. So some people, yes, they are using some of these products. They feel they are not really there. They want to be there. Their definition of beauty, it's a bit different. So no matter what you do, no matter what the products you prescribe for them, they will still tell you they want something else. And definitely that is something that we need to look into. So yes, celebrity culture, low self-esteem, then misinformation. There are times when I have most of my patients, they come to me asking me in terms of, is there any difference between glow or even toning, bleaching, whitening, brightening, all these. And sometimes we use certain products because of misinformation. Now, the next question is, so what are somebody's asking most common active ingredients in illegal bleaching creams, and why are they dangerous? So the common ones that we all know is hydroquinone. So some people do high doses of hydroquinone. You can also have potent steroids, clobetasol for instance. So these days the new trend is people buy some of these steroids and they pour them or they mix them with their creams and they use as an everyday cream. So definitely some of these steroids, potent steroids, are also part of it. Then we need to also talk about sometimes the mercury derivatives, for instance. Some even use some caustic acid. So, and there are times when some people do very weird mixtures. We cannot really tell exactly what is in there. But once they start using, you notice that their complexion is changing. So, largely, I would say we use more hydroquinone and now potent steroids in terms of the agent or what we use as bleaching creams. Then one is asking, so why are they dangerous? They are dangerous because not only are they damaging our skin, sometimes you can also have them damaging our organs. And by the time we finish with this program, you understand why we are very very we speak against skin bleaching, because it is not only a skin issue, it cuts across. So sometimes not only about the skin, we also have people getting some of these complications, and we are going to discuss it. We are going to talk about it. The next thing is somebody is asking, how has social media and influencer marketing changed the way bleaching products are promoted and sold? So definitely social media has made bleaching more discreet and aggressive, through influencers. So for instance, when it comes to their definition of glow, for instance, glow language, and some of the before and after videos that they share, private DMs, and unregulated online sales. So, because of these, it really made now some of these actives, these organic products, very easy to patronize. So, definitely, social media has a strong hand in here. And definitely, you see how powerful social media is. So, influencers, how they define certain, so for instance, how they define their glow, how they define their tone, or how they define some of these terms, definitely affects it. So, I would say yes, it has. The next question is, what role do colorism and beauty standards play in sustaining the epidemic? Yes, colorism has been with us for a very long time, pre-colonial stuff. So there's always a Western influence. How we look, how we see each other, or even how we define certain things, it depends on the people that we look up to. So then, up till now, some people still define beauty in terms of fairness. And I keep on saying, you can actually have a healthy skin without necessarily using a harsh product. You can have a healthy glow without necessarily actively using some of these actives or using some of these products that will rather make you fair. You see? So, back then, I remember years back, we used to have this old medication. There's a brand we call Dexacortin. It's years ago, where people take Dexacortin. Dexacortin is a steroid, by the way. So once they start taking, it makes them put on weight. So you are putting on weight, and they're also using some of these harsh creams. So Abidjan creams. It used to be popular back then. And people are using all sort of creams. And the outcome was, so they've put on weight. They look, usually the upper part of their body, definitely it's bigger than the lower part of their body. Then they also look fair. Then as time went on, there were instances of people complaining about exogenous ochronosis, non-sorben. So non-sorben came into the picture. People were having darkening of their faces. People were having darkening of their knuckles. And sometimes, very early stage, people get, these days they call it sunburns. And these are all the early part or early stages when it comes to them. Then, with time, people with all these complications now started getting even hypertension. And people with a history of diabetes started getting, worsening diabetes, or the sugars now difficult to control. So it tells you the extent or the damage not only on your skin, but then definitely that some internal organs are also affected. So that is the reason why this conversation is important. Now the next question is, what happens to the skin barrier when harsh bleaching agents are used repeatedly? So colorism, as we said earlier on, we say it sustains the epidemic by falsely equating, lighter skin or lighter skin with beauty, and success. So as we said earlier on, social acceptance. So these days, you are supposed to look a certain way. Your complexion you're supposed to look in a certain way, and this cuts across. So social acceptance definitely affects us. Then, if you ask about how repeated, so usually this is what happens. Repeated bleaching, it weakens your skin barrier. Very important. Now, this reduces these protective lipids or oils that we have in our skin. So the outcome is it thins out the upper part of your skin, the epidermis. So it thins out your epidermis. It disrupts, what we call the melanin defense. Melanin is supposed to add some level of protection for our skin. And once this happens, or once you keep on using some of these strong creams, that's what happens. It disrupts the melanin defense. It also increases sensitivity. So you have somebody telling you, Doc, almost all the products I use, I react to them. So you have somebody telling you, even when I use just shea butter, my face starts burning. And when you take your time, you notice that they have been using a certain cream, a certain harsh cream, for a long time, and it has affected their skin barrier. So definitely it increases sensitivity. Then we talk about infections. A very common one is fungal infection. So we have people, for instance, somewhere last year, had a patient who had an extensive fungal infection, what we call Amitina vesicular, all over. And she's been using some of these harsh products for a long time. So then she has widespread stretch marks. In addition to the stretch marks, she also had this, fungal infection. So definitely, because the protective function of your skin is impaired, so it leads to infection. Then we talk about acne. So sometimes when you use, especially the potent steroids, some of these bleaching products, it leads to acne formation. Then what we hate stretch marks. So these days, people are getting stretch marks not necessarily because they are putting on weight, but the reason is very simple. They are using a strong cream. Some of these creams, what they do is they damage your collagen. Collagen is found in your dermis. So once the collagen is destroyed, people end up getting very horrible stretch marks. And I keep on saying, the longer you use it, the more difficult that stretch marks, in terms of treating it. And that's the main reason why anytime you are managing stretch marks, you need to take a very good history. You need to isolate the insult. Whichever product that is destroying the skin, it has to be stopped. That's very important. And again, poor wound healing. So once you use some of them, especially the potent steroids, it impairs your wound healing. You need collagen for wound healing. And that's the main reason why you can go for a simple cesarean section. You can go for an elective cesarean section, but you notice that the wound it's not healing. Sometimes it takes days, it takes weeks, it takes months. And sometimes the longer it takes, the higher risk of it getting infected. It's more like a cycle. So the reason why most of our elective surgeries are not healing, the incisions are not, the wounds are not healing, it's because of the creams that we use. So definitely it impairs wound healing. Now, the next question is, I think we even spoke a bit about, what are some of the short-term and long-term health risks? Dermatologically, hormone, okay. So we spoke a bit. So I'm going to, let's break this into short-term or the acute ones and the long-term ones, the chronic ones. So the first one, as I said, because it increases the sensitivity. So let's talk about mildly, you have burns. So when you start using some of these creams, you realize that anything that you use, it burns your face. So that's the first one. And two, dermatitis or skin irritation. So there are times when you use these products and you notice that you have this itchy rash. And there are times when your face becomes red, which comes and goes. So because your face has become sensitive, anything that you apply, you end up reacting to it. So dermatitis definitely is a short term or is an acute thing that you get. Then acne. Some of these products, especially with the steroids. And the worst thing is, most people treat hyperpigmentation or dark spots with strong steroids. People use Fambact A. People use Salfax. People use these triple action creams to treat their hyperpigmentation. And they get hooked on. So what happens is, anytime you stop, you have a rebound rash. So we have these steroid-induced acne. Very common. And it's one of the most difficult things to treat. So anytime you come off it, it comes back. So some people are constantly on these strong steroids. In fact, some people mix them with their creams. Now, it thins out your skin, as we said earlier on. Then stretch marks. So some people are getting stretch marks not because they are putting on weight. No, it's because the cream they've used over these years it's a bit harsh and it's destroying their skin. Then let's talk about the long-term ones. So the popular one is what we call non-sorbent. So non-sorbent is what we call exogenous ochronosis. These days, a very earlier stage of it, you don't get the typical darkening of your face, but rather it's just around your eye. So these days, some people call it sunburns. So anytime or anyone who has experienced sunburns, what we are telling you is that's a very mild form or very early stage of exogenous ochronosis, non-sorbent. So what it means is you are using something, you are using a product on your face that is a bit harsh. So the sunburn is just for you to more like review the product you use on your face. Then we have hormonal suppression. So more importantly, that's the reason why we need to always, almost all the time, we need to measure your cortisol level. There's a hormone called cortisol. And this hormone basically is it helps us to withstand stress. So some of these strong, the potent steroids, and that's what they do. So definitely hormonal suppression is also a long term. Then even hypertension, worsening of your diabetes. And some people, kidney injuries, especially with the mercury based ones. So these are some of the complications that we get when it comes to using some of these creams. The next question is very interesting. How do you differentiate between cosmetic lightening and medical treatment for hyperpigmentation? So, and this is the reason why we are still talking about skin lightening or skin bleaching. Now, people go for these lightening products not because they want to actively bleach their skin. And that's the reason why I keep on saying we need to approach this with compassion. It's not everyone that go in there to actively alter their complexion. No. You have people who have dark spots or PIH, post-inflammatory hyperpigmentation from acne. And in an attempt to clear the hyperpigmentation, they buy some of these bleaching products. So what happens is, yes, they are lightening the whole area in terms of the whole face getting lighter, but the dark spot is getting darker or becoming more obvious. And that's an issue. So sometimes you don't go in actively to change your complexion, but you're just going in to treat your hyperpigmentation. So medical treatment for hyperpigmentation, first of all, it is diagnosis-led. 2, it is time-limited. 3, it is usually monitored and targeted. So you need an expert. Your doctor is treating it. So first of all, it has to be diagnosed. We need to be sure it's just a PIH. It's not melasma. It's nothing else. It's just a PIH that we are dealing with. So those ones, the treatment is a bit different. Those ones, the treatment is not long-term. In fact, if you are treating PIH or post-inflammatory hyperpigmentation, just two important things to use is your moisturizers and your sunscreen. Sometimes these alone will fade it nicely with no actives. So definitely that is that one. Whereas when it comes to cosmetic bleaching, it often continues. It involves the whole body. It's unregulated and it's aimed at changing the natural skin color. So these are the differences between treating hyperpigmentation and also the cosmetic bleaching. The next one is, what signs should someone look for that indicates their skin barrier is compromised? So skin barrier is your skin barrier plays a very important role. So it has a protective function. So anytime there's an impairment or there's a broken skin barrier, there's a problem. Now, I'm going to share with you symptoms of broken skin barrier. So the first one is burning or stinging. So there are times when almost anything you use, sometimes you've not even applied anything, but your face is burnt. Now, some people get these redness, and others too, their skin peels, so peeling of your skin. And others, I mean, easy bruises. So they are sometimes just by touching their face, you remove your fingers and you see your fingers, that had marked or stamped on their faces. Then visible veins, very important. So there are times when you notice that people they tell you they have red veins or they have green veins. So basically, your skin has become thin, and you are seeing these, or you are getting all these veins as well. Now, recurrent rash. So broken skin barrier, they tend to get recurrent rash. Very important. When it comes to acne flare-ups, we spoke earlier on. So when your skin barrier is broken, some people tend to get these flare-ups. And the dark patches, as I said, we call it sunburns. So that's how it starts. With time, it progresses to what we call, or to full-blown exogenous ochronosis. Then, when your skin barrier is broken, some people react to almost everything. Anything they apply on their face, they end up reacting to it. The next question is, can skin damage by bleaching ever fully recover? And what determines the outcome? So, I have good news for you. But the earlier, the better. So, you can recover, or the complication associated with skin bleaching, the topical one, the skin complications. Yes, we can recover, or yes, we can be almost recovery. So recovery is possible, but not always complete, depending on how long you've been using the harsh product. Very important. Now, the outcome depends on the duration of the bleaching, for instance. Sometimes even the ingredients used, whether potent steroids or you are using the high level hydroquinone. Even the depth of the damage, so the extent of the damage, definitely. And whether or not there is a presence of ochronosis or non-sorbent exogenous ochronosis. So that these ones, it takes time to recover. Infections. So if there are infections, we need to treat the infections before attempting to, treat anything else. So how early the treatment begins definitely will influence the prognosis or the outcome. So this is very important. The next question is, what does skin barrier repair actually mean? Okay, so when we say skin barrier repair, what we are doing is we are restoring the skin. So the skin has what we call stratum corneum, the structure of the skin. So the skin has some lipids, it has some ceramides, it has some natural moisturizing oils, basically. And it also has a certain pH balance. And what we are doing when it comes to skin barrier repairs, we are trying to repair all of them. So the immune resilience, everything we are trying to repair. So when we say you are repairing your skin barrier, it just means, first of all, the insult needs to be taken away. And secondly, we are making your skin back, or taking your skin back by improving your stratum corneum and all the oils. We are basically refreshing your skin. So that's the main reason why the offending or the trigger should always be removed before you repair. And the next one is very interesting. They say, what ingredients or skincare routine are evidence-based for restoring a damaged skin? So as I said earlier on, the most important thing is to move away from the offending product or the offending ingredients. Very important. Now, the evidence-based ones, first of all, you need gentle cleansers. And I'm going to explain this one. So some cleansers are alcohol-based. So we don't need alcohol-based cleansers. You need things as mild as ceramide-based ones. So definitely you need ceramide. You need glycerin. So glycerin definitely will also help. You need hyaluronic acid. You need niacinamide. So these are the things that you need. Now, anytime you have a broken skin barrier And how you know, the symptoms that we mentioned earlier on. First of all, you need a moisturizer more than anything else. However, if your moisturizer is a harsh one, and my definition of harsh is if it contains any of the things that we spoke earlier, all these, steroids, and then we need to move away from them. So you need a moisturizer, and the next thing you need SPF, so sun protection. So these are the most important things we need when it comes to, or when we have skin barrier, broken skin barrier. Now the next question is, how long does it take typically for your skin to begin to repair itself after you've stopped bleaching a product? So we need to understand that the how long depends on how long a duration that you've been on the bleaching product. So if you've been on it for a long time, what it means is the recovery also takes time. But the broken skin barrier, sometimes 2 to 6 weeks, it can be fixed nicely, especially when the insult is taken away. Now, sometimes it can take months. So depending on the extent of the damage. The next question is, what role do dermatologists play in helping people safely transition off the bleaching creams? And this is a very important part. I keep on saying we need to approach this with compassion. Again, we need to approach people who have used actives that has unfortunately led to these complications that we spoke about. We need to approach them with compassion, with love, with care. Because the number one cause of failure in treatment when it comes to skin bleaching or exogenous or chronosis is the fact that they started treatment and they are forced to go back because of the comments that are passed or some of the comments that they hear. So anytime you see a patient who has used a harsh product and the patient is trying to repair their skin, it takes time. And there are times when we say it gets worse before getting better. So the approach to skin complications from skin bleaching is compassion. Your patient should be your friend. If you don't do this, what will typically happen is, yes, they will start with the process, but unfortunately, they will go back not to the same product, but maybe a different product. But you notice that it's the same, family. So let's approach skin bleaching with compassion. Very important. Then the last question is, so are there treatment available in so yes. Now, dermatologists help by, first of all, identifying the insult or the trigger. Very important. We also manage the flare-ups. So if you are reacting as a result of some strong products that you've been using, we manage the flare-up. Very important. Then we treat the infections. So as I said earlier on, you can have a florid fungal infection. Sometimes extensive. It covers more than 70% surface area. And anytime you see this, in addition to checking or reviewing the products the patient is using, you need to also rule out immunosuppression. So yes, these steroids, they also reduce the immunity, but you need to also do some labs, especially, HIV, check the sugar level. These are very important things that we do when it comes to anytime you see a florid or an extensive, skin fungal infection on your skin. Very important. Now, if you just joined us, we have been discussing a very sensitive but yet important discussion. We've been discussing skin bleaching. And our focus is not on the why people are bleaching. No, our focus is repair. We need to approach skin bleaching with compassion. Sometimes it's no fault of some people. Some people go in there, recommendations, social media recommendations. They have been recommended certain products, but unfortunately, they started using these products and they've noticed that they are getting all these, remarks. They're getting fair, they're getting all these stretch marks. Their skin has become thin, and anything they apply on their face is almost immediate. They are reacting. So when it comes to skin bleaching, there's nothing like you condemning people. No. It has to be approached with compassion. And we are also saying that depending on the extent of the bleaching, it tells you the prognosis. So how quick we can resolve this issue depends on the extent of the damage. And that is the reason why we don't want the damage to be there in the first place. And that's why we are embarking on this awareness creation. Somewhere last year, Skin Foundation Africa, we brought a project. The project was aimed at helping people, helping them transition from the harsh product, to their, in quote, normal product. And it was amazing. You realize that most people want to transition, but their problem or their worry is stuck. Once I stop, I'm going to be even darker than before. People are saying, I've seen people who they went off it, and it's now destroyed their face. They've become darker than even before they started using these creams. So, if you are listening to me yourself, or if you know anyone who has used any harsh product, here we don't judge. I'm going to put a number out here. Always just call this number. You need a consult. We are going to help you transition from the harsh product to, the in quotes, normal product. Or if now almost anything you apply on your face, you are reacting. This number is also for you. Get in touch and let's take it from there. So the number is 0244 74 6768. Or you can equally call 0246 06 3807. Get in touch with us and let's fix this problem once and for all. We have quite a number of questions. So the first question is, what are the most common chemicals used in skin bleaching product? Oh, we spoke about that earlier. So the most common ones are the high level or high percentage of the hydroquinone, definitely. The potent steroids now. Some people use mercury derivatives and stuff, and caustic acid. So, but the commonest ones are these high potent steroids and the hydroquinone. And then Ake is asking, how can skin barrier damage from bleaching be identified? So we spoke about some of the symptoms. We'll go over again. So the first one, some people redness, very common. Then burning. Some people it stings. So they tell you their face is stinging, it stings. Or even when they apply water, the water is even burning their face. Then sometimes their face becomes reddish or red. So redness of your face. Then there are times when almost anything you apply on your face, you are reacting. And so these are very early stage of, or these are symptoms that points to a broken skin barrier. Kwesi is asking, what are the most effective methods for repairing a damaged skin barrier? So the first most effective thing we do, Kwesi, is to stop the product or to remove the insult. Sometimes the truth is, if you just remove the insult or the product that is causing these, all you need is just a moisturizer and your sunscreen. That's it. So the first most important method or thing to do is to stop the offending cream. That's the most important thing to do. Then, how can education and awareness creation help reduce the prevalence of skin bleaching? And that's why Z Multimedia with Skin Foundation Africa, we do this every Saturday, 6:30 p.m. And you can also join us. You can also follow the Skin Messiah everywhere. The Skin Messiah on Instagram, the Skin Messiah on TikTok, Skin Messiah on Snapchat. So what we've been doing is we are here to educate people, awareness creation, advocacy, very important, advocacy. And also, research, basically. So that is what we do. That is why we spend so much time educating people on skincare. And the truth is, if you leave this, or if because of the how effective social media is now, some people, as I said earlier on, they don't go in there or they don't want to alter their complexion. No. Definitely, apart from colorism, misinformation is also part of the reason why people use some of these harsh products. It's of no fault of theirs. So that is why we are here. Z101.9 FM or Z Multimedia has taken this, initiative. So join us every Saturday, 6:30 p.m. Next week, Saturday, we are discussing something that you just cannot miss it, especially as a mother or potential mothers. Don't miss it. We are talking about baby skin care, because these days we are realizing a pattern. We're realizing that people are using harsh products on their babies. Not only their baby skin, their hair as well, their scalp. So next week, Saturday, we are discussing baby skin care. You just can't afford to miss it. Now, Ajwa Frida is also asking, so how does skin bleaching affect the natural skin barrier? We spoke earlier on Ajwa, so I will go over it again. So what it does is, it breaks your skin barrier. And earlier on, I explained how it does this. Ronnie is also asking, what cream will you recommend for a pregnant woman? So, pregnant woman, definitely, especially if it's first trimester, she needs a very, first of all, mild to almost zero fragrance. So, a moisturizer that has almost zero fragrance. That's the first one. Two, she needs a very good moisturizer. So, sometimes because of the pregnancy, so hormones, because of certain hormones that arise or that surge during pregnancy, you need your moisturizers. So yes, normal shea butter is fine, but then if you have eczema on top of it, so if you are pregnant and you have eczema, then I'm going to recommend what we call Derma hydrating cream or Derma hydrating oil. Very, very, very effective for pregnant women. Now, let's move on to that. We are almost done. Feb is also asking, what role do cultural or societal pressures play in the continued use of skin? Febs. So we spoke earlier on. Definitely culture, or definitely that's where the birth of these, colorism, we spoke earlier on. It has a deep, or it is deeper than what we think. So how beauty is defined, is even different. So definitely it has a strong impact. And now we are trying to change the narrative. We are changing this by painting the other side. We are saying once you've had it, it doesn't mean you cannot stop. You can stop. We can help you transition from the harsh product to the less, harmless product. we'll take the last question. Then we draw the curtain. So now is asking what are the short-term and long-term health. Now we spoke about this, but I'll just go over again. So the short-term, when it comes to some of these harsh products, the first most important thing is one, dermatitis or skin irritation. So some people get these burning sensation when they use some of these products. Then we also talk about, apart from them, people are getting acne flare-ups as well. Then some people, almost anything that they apply, they are reacting. Then we talk about the infections, especially fungal infection. That's very important. So some people are getting fungal infection, and some people around their mouth, around their nose, around their mouth, the area becomes lighter. So all these are fungal infections as a result of the creams that they are applying on their faces. So infections. The long-term ones, as we spoke about sometimes you go for a surgery, your wound is not healing, so poor wound healing, and some people are getting stretch marks, some people are getting veins, pink veins or green veins. Then some people, when they have a cut, it's taking a long time to heal. After healing, the whole area becomes dark. Then hypertension, worsening diabetes, and sometimes, hormonal suppression, especially the cortisol level. You are no more being able to withstand stress. So these are some of the complications that we spoke about. And unfortunately, this is where we draw the curtains. Thanks for listening to us. This has been the Derma Dialogue on Z101.9 FM, where we educate people. We create awareness creation about our skincare. You can join us every Saturday, 6:30 p.m. And next week, you just can't afford to miss it. Next week, we are discussing baby skincare. So skincare, how different is babies or even kids? How different their skincare from adult skincare? So all of you, thank you so much for listening to us. It has been the Derma Dialogue, and I've been your host, Dr. Kofi Ansah Brefo. Have a good evening and take care.